healthcare system can collapse easily over there, no, in these countries. I would say that here, if you are older than 65 and you have comorbidities, obviously, yes, I would encourage we can use a second booster. I would say that for younger people, and if they don't have comorbidities or they're well controlled, I think we can wait. But for everybody that I know, I have told them, well, if you're 65 and older, I will say yes, you can get, especially if it has at least 5 months from the last dose, from the.
Another question.
Uh-huh.
Is there any data out there as to, the amount of antibodies from a person having been exposed or contracted COVID-19?
Yeah.
As opposed to those who have received, vaccine, any data to show that, because there was a lot of breakthrough,
Yes, there's a lot of breakthrough infections even with vaccine, especially with Omicron. I think with Delta, we didn't see the same number of breakthrough infections. But, use my voice. But with Omicron, I feel that the infectivity rate was much higher. And in general, I feel that we know that the vaccines, even with the 3 doses, were not as effective, at least for breakthrough infections. But all of them, if you actually see on, even on the public news data, is that they barely had any symptoms. And anecdotally, I have to say, I know so many people, physicians and physicians that were triple vaccinated and they got infected, but they had barely any symptoms at all. Compared to patients, especially here in Louisiana, during the months of January, because we have so many people that are not vaccinated. I pass through the MICU when I have to go to the Kings Highway. It was full. It was full of people. So the main difference was like, well, they can have breakthrough infections, but they were not in the ICU. So I will say that, there have been studies in regards of, natural protection after infection, but, the studies have shown that, natural protection from infection or natural infection will be less compared to vaccination with triple doses. Right now, I will say that most protected people are the ones that had 3 doses and a breakthrough infection. Those are the ones that are the winners so far. But in general, for 3 doses versus people that never had any vaccines, you have way more protection in regards of disease severity. And I'm telling you that I know several people who were infected but were totally asymptomatic, or they were like, well, I have to be in isolation. And CDC tried to lose the isolation guidelines because some people that were vaccinated with 3 doses and they got a breakthrough infection, by day 5 they had barely any symptoms, so they won't go back to work because that the old rules mandated you to be on isolation for 10 days. But the good thing about vaccines is that your symptoms are way shorter in duration and in severity. However, at the same time, for us it was tricky whenever we received those new update guidance because a lot of people that got infections were not vaccinated, right? And then by day 5 or 6 they could still have symptoms, but they were going back to work anyways, because we have to understand that most companies, big places, people don't have any more sick days because they already had a lot of sick days, not only for themselves but also for taking care of children, taking care of parents.
Here at the State Chaplain Conference, the State Chaplains Conference